Good afternoon.
Mm. Okay, go ahead.
Good afternoon.
Good afternoon.
This is Dr. Mozna. I'm one of the baby doctors. I believe I'm talking to Samia.
Yes, doctor, this is me.
Samia, thank you for coming over here to discuss about Umar's condition. Is it fine? Can we discuss?
Yes, sure, doctor. I am very much worried about him.
Oh, I'm really sorry to hear that. And we are here for his best in health. Samia, do you want someone to be with you while we are having this discussion?
No, doctor, I am alone now. So you can go ahead.
Okay. Samia, I just wanted to let you know about a certain procedure that we want to do with Umar. Uh, so how far do you know about Umar's condition?
Yes, doctor, my child is was fine till now. He's a very good growing boy.
Yeah.
Suddenly, yesterday he had high fever, and along with that, for the first time, he developed fits. And we were very much worried. We rushed to the hospital, to the emergency, and we spent the night in the emergency, and then the doctor said he should be in the high dependency unit,
Yes,
and
yes.
presently he is in the high dependency unit. This is what I know about him.
And presently he's presently well and stable in the dependency unit, right? Samia, I just wanted to tell you that because he had this fever, and along with fever, he had these fits. At some point of time, we feel that probably there could be a brain infection that should be ruled out. So that is why we are kind of doing this procedure called as lumbar puncture. So do you know about lumbar puncture? Have you heard anything about it?
No, 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 doctor. This is the first time I'm hearing. What is it exactly?
Okay, I'll try my best, Samia, to make it as simple as possible to explain to you what it is and how things will go about. At any point of time you feel that I'm fast or you don't understand, please stop me. Okay? So,
Okay.
Samia, here I would just like to tell you that there will be a small needle that will be put, from the back, the lower back area of Umar to remove the fluid, the brain fluid. Are you
Can
with
you
me,
share the
Samia?
picture?
Yes, yes. I will just one second. This is the brain, Samia. You can see,
Okay.
and this is the
Okay.
cord we call the backbone, which has the cord. Even this cord has the fluid of the brain, Samia. Are you with me?
Okay. Yeah, yeah, yes, doctor.
So there will be a small needle that will be put from the lower back area, from the spine area of Samia to remove this fluid.
But doctor, this looks very scary for me. My son hasn't got any injections or any needles before. This is the first time. I am very much afraid this might damage his nerve cord there. So I don't think I will go for this procedure because compared to yesterday to here today, he is much better.
Yes, yes, yes. I can see, Samia, that you're very worried about Umar's health, and so are we, because we want to know whether uh, is he having some big brain is he having some infection in the brain? Okay, because he is doing well after receiving the medicine. You're with me, Samia?
Yes, I am there with you. But can it happen like in one day he can have this infection in brain? I am surprised, and he's fine today because you're telling you will put the needle near the nerve cord, and maybe you may do more damage to him
Yes,
than benefit.
your concern is about the damage, right, Samia? Let me tell you that this will be done in a more pain-free procedure. Okay, we'll try to make it more pain-free. Moreover, it will be done in expert hands. Okay, where the experts are going to, ones who have done this procedure many times are the ones who are going to introduce. The chances of nerve damage are, to be very frank, nil in this baby. So we are not going to have any nerve damage per se. We'll make this procedure very pain-free. At the same time, we'll see to it that there are other precautions that are taken, no infection that takes place. So we'll make it we'll keep everything very clean, so that there is no infection that is introduced.
Okay.
Have you known about any person who has?
How you can say that when you are putting a needle, definitely there can be some damage, right, around it?
Well, see, this is not this is not a complication, or this is not a known complication for this procedure, lumbar puncture. We will try to introduce, and this is in fact necessary for the best health of Umar. Do you know why? Do you know why do we want to do it?
Okay. Why you want to do it? How it will help you?
Yes, and let me tell you that if I come to know that there is an infection in the brain, I will be giving the antibiotics that I'm given right now through the blood channels. I'll be giving it for a longer period of time. Even if he is well, I'll have to continue that so that the infection gets cured completely in the brain.
Oh, okay.
Unfortunately, yeah. Tell me, Samia.
Apart from this,
3 minutes left. 3 minutes left.
Okay, any other complications he may have apart from this with due to procedure?
Yes, Samia, I know you're worried, and it's your right to know about this. So the thing is, a child might have some headache, after this procedure, but we'll see to it that we'll give a lot of fluids to Umar. We'll keeping him in a lying down position so that this headache gets relieved. And even if it occurs, we can give him some painkillers, and it will go away in a day or two. It's not necessary that he'll have a headache, but he may have a headache.
Doctor, when you are telling that you want to know how long you want to give antibiotics and lots of benefits from this procedure for him, why it was not done yesterday, and so that it would have helped you a lot? Why it was not done yesterday?
Well, probably yesterday. I'll just, he might be in a state where doing this might not have been possible. He was having a convulsion. He was actively convulsing. So at that point of time, probably because of that, he was not stable. So now that we feel that he is stable, we are going ahead with the procedure.
Really, this procedure is, I am worried. Still, I am not convinced. Can you give me any alternative through which you can diagnose that there is brain infection or not for him? Do you have any alternative for this?
Well, scannings are there, scan procedures are there, but they are not as good as this procedure who can find out that there is an infection in the brain. And this procedure is definitely the one which will let us know. And even in the scanning procedure, it will be a lot of, it will take the child, your baby. Having the scanning procedure will also be troublesome for Umar.
Okay, the scanning procedure, but it will not be, you will not put any needle or anything, right? So it will be more safer, and if you know it's brain infection, it's more than enough for you, right?
Please pardon?
The scanning procedure, you will not use any needle, so it will be more safer for him.
Well, in the scanning procedure, there can be, he might not be cooperative. So we might have to put a needle via his brain channel, to kind of make him sleepy or sedated, as we say, so that he does not move in the scanning procedure.
Okay, doctor.
That is also worrisome. And this is definitely superior to that scanning procedure.
Okay, doctor.
So let me summarize, Samia, about this, what we've discussed today.
Okay, go ahead, doctor.
Yes, at the same time, I will even be giving you leaflets about the procedure of lumbar puncture so that you come to know in detail about what it is, right?
Time over.
Okay, no problem. Even if you don't summarize, it's okay, no problem. But the answering the concerns of the role player is more important. And along with that, just finish about the leaflets and trusted websites. Okay. Hello, you're listening to me?
Yes, I'm listening. Actually, my children are making a lot of noise, so hence I'm muting it.
Okay. And trusted websites you can tell. And finally, you would have asked about the consent. What do you think? You will go for this procedure or not? Or do you want to give me
That
the
I have
consent?
written, and I
Because
just
this was your
forgot that you have
finally,
to
if
ask for
you have
consent.
asked her, then it's her choice. She may agree with you, or she may say, I may need some more time to think over. Then what you will tell if she tells like this?
Well, at this point of time, I would like to share with you that this is a urgent procedure. So if you could take your decision early, that would be really good.
Okay. You can give her some time, telling that you can discuss with your husband and come back to me, no
Discuss with your
problem.
spouse.
Or if you want a meeting with our consultant, I can arrange like this. Okay, because presently he is stable. According to the scenario, what it is written in the scenario, now he is stable, but he is in high dependence state for observation. But he is stable. Presently, he is stable.
Yeah. But I was just thinking giving more antibiotics might, change the lumbar puncture picture. But yeah, definitely we can give her time.
Yeah, we can give a time because already you have started the empirical antibiotics. And
Two
he's
things.
stable presently, and the mother is worried. You can give her some time to decide over, or you can give her also the option of arranging a meeting with consultant. What do you say?
Yeah.
Any comments for this?
Yeah, actually, here two things should be addressed. That one thing is the result can be we cannot find any bug because treatment has already been started. So this can be a negative result. Can be a negative. This should be tell to the parents because they are waiting. What is the bug behind? And after that, you have started the treatment and you are doing the CSF, and the result is coming. There is no bug. So what will you say?
Why are you doing
So
it?
yeah, so you should tell that result may be or may not be. So this is the one thing. Another thing about the about this second thing about the MRI or CT scan, what Dr. Muzra was telling, the brain scan, it will not tell about the bug or it will not tell about the infections properly, and we have to do because
Just MRI will show that there is, at times it shows that signals which
yeah,
what is it, high
they will
intensity
show just
signals,
enhancing
meningitis.
enhancing of the signals
Yeah.
only, but we are not sure that this is due to infection or something else.
That's
And
why I
it
just
will,
told it's superior. This is
yeah,
superior to this.
yeah, even this will not tell the about the bug. So we will not in a position to how much time we should give the antibiotic, and the which antibiotic is suitable for the for to kill that bug. So for
Yeah.
that, this is superior. These two things
Which
you can
antibiotic?
add.
Yeah, I did not see that.
Yes, one point also needs to be clarified that even if there is no but if this cells show high white cell count, this highly indicates that it's proved to be infection in the brain, and this one leads us to continue the management. For example, we will continue follow-up for his development, for his hearing.
I'm so
But if
sorry,
the
Dr. Ola, I couldn't
initial,
understand. What you please
yes,
pardon.
for example, one is not shown about, but high white cell count, which is suggestive of meningitis. This one will lead us to continue later on management and follow up. So if the, for example, if it is a high white cell count and no microbiology is negative, so this partially treated meningitis, but we have to continue monitoring for his development, for his hearing. But if the test is no bug and no white cell count, so this one will make us reassuring. That is, we will not expect any further complication later on. Is it clear? Explain it.
Okay. Now, there are some things which you did not answer clearly. And in your drawing also, there were some deficiencies which I want to tell you. So we can do one thing, otherwise the same things you can ask, like why you want to do this procedure, I am afraid, and what are the complications, I am worried, there was no needle given, and another thing is what is the alternative, and also why it was not done yesterday. All these the same questions you can ask, and we will do it again. Okay.
Okay.
Or any other questions, no problem. Okay, Dr. Ola, you are free, you can keep the time.
I'm okay with it.
So again, I myself forgot the names. Umar and Samia, right?
Yeah, yeah.
Mother is Samia and Umar is 7 years old. Okay, we will start, Dr. Ola.
Yeah, okay, start.
Good morning. This is Dr. Noor, one of the children's hospital in this, one of the children's doctor in this hospital. Am I with Mrs. Samia?
Yes, this is Mrs. Samia.
Yes, I am taking care of Umar. How is Umar now?
Well, I was very worried, doctor. Yesterday, Umar was in a very bad position. He had this fever, and first time in his life that I've seen him, having this fits. That's why I brought him to the hospital, and he was kept in some HDU. I don't know how he is right now. Nobody has spoken to me since morning.
I am sorry, and I can understand that as a mother you're worried, and that's why we are here to do the best for Umar. So, in what do you know till now about Umar's condition?
They have put some needles in his blood channels, and they're giving some antibiotics, something that they were telling, and that's what they are telling that that's it that they told me.
Okay. Yes, Mrs. Samia, I want to assure you that compared to yesterday, today Umar's condition is better. He's stable now. We are in continuous observation for him. We are continuously observing, but presently he is stable compared to yesterday with all this treatment.
Can we go discharge, doctor?
No, because he had fits yesterday. We need to know the exact reason why this happened with him. So we need to observe him. Mrs. Samia, today I am here to speak about Umar's. We want to do a procedure for Umar, which is known as LP, lumbar puncture. Do you have any idea about it?
Oh my, lumbar puncture. Is it the same procedure of giving that injection in the back?
Yes.
Oh my, doctor. No way, doctor. I had that during my cesarean for Umar, and I am having a severe back pain till date.
I am sorry for that, but see, Mrs. Samia, every procedure has the benefits and the risks. There is a great benefit by this procedure to him. Are you with me?
Yes, doctor, but he's a 7-year-old child. Will he stay with that back pain forever?
No, actually, what we will do is this procedure will be done by the experts in the field, and they will see that the pain is minimized and the things will go right. They will do their level best. But maybe sometimes he may have the pain and other things, but they will do their level best. So, do you know about the benefits of this procedure?
Exactly. Why would my 7-year-old boy have to undergo this procedure? Doctor, first tell me.
Yeah, yes, this is a very good question. Actually, you see, he developed fits yesterday, and as I know, it is for the first time with high fever. So our worry is there may be some brain infection. This is our worry. So we want to rule this out by taking a small fluid from this area. So Mrs. Samia, what we exactly do is there is a in the backbone we have number of small backbone bones here, okay, and inside that there is a channel where there will be running a card here like this, okay, it's a nerve card, and then in between these two bones we will put a needle, but we will put in the area where there is no nerve cord. Here there is no nerve cord, only fluid is there, so the damage to the nerve won't be there. So we will just put and take a little fluid from this area. Am I clear to you, Mrs. Samia?
This is so scary. This sounds so scary.
I am sorry for that, but the benefit of this is we will know what is the reason for his infection and how long and what good antibiotics can we give. We can give the best treatment for him by doing this.
Doctor, give it that. Give that. I'm ready. How many days? Which antibiotic? I'm ready to stay. Give it without this.
Uh, Actually, the benefit is maybe we are giving some antibiotic and later he may not respond, and if this bug will not respond to this, he may have more infection and more other problems which we don't want to happen. So by doing this we may get to know the bug, what bug he has and what is the best antibiotic for him.
Okay. Okay,
This is
doctor.
one thing. Other thing, also maybe he may not have this infection also, or maybe what antibiotics we are giving has treated him better. So we may not get bug also, but we will come to know what exactly is the best for him. This is the reason we want to do.
Can we do some other investigation, other tests rather than this? This sounds very scary, doctor.
Yes, Mrs. Samia, I can understand. But you see, I cannot tell you that any alternative is better and it can give us a right diagnosis for his brain infection. Anything else, it
3
cannot tell
minutes.
us. Any other investigation will not tell us that what bug he has and what is the right antibiotic for him. So cannot give you any good alternative for this. And I want to assure you, we will try our level best to do the best for him without any complications.
Complications? What complications can occur, doctor?
I mean to say without any, we will try, like we put a needle, there can be some blood or like this, but usually it is done by the experts hands who have already done many lumbar punctures and they know it better.
Okay, so only blood bleeding is the only thing that can happen, no other
Yeah,
complication.
as I told you, there won't be any nerve tissue here. The damage for the nerves will not be there here. Okay, only maybe some blood may come out or there can be some chance of infection, but already we are treating with the antibiotics and we are taking care of it.
Okay, 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 doctor. Fine, fine, doctor.
So any other concerns you have, Mrs. Samia?
How long will this procedure take?
It will just take a very only some time only. Not much. We will just put, we'll just see to it that he will not have pain. We'll use something for the numbing the area, and we will just put a small needle and take the fluid, and that's it.
After that, he can sit and eat na nicely then. No issues of sleeping or anything.
No, not much issues. But if you have any concerns, the person who will do will give you all the, will discuss with you everything before that. What to do before and what to do after. You will have a meeting before doing the procedure.
Yes, yes, doctor. Please do keep that.
Yeah. So, what do you think about giving a consent for this procedure?
I'll talk to my husband, doctor, and let you know in a few minutes.
Okay, sure. Take your time. But as I told you, there is at presently he has this procedure will give the best benefit to him. Okay, and I also want to give you some trusted websites to go through the procedure, and also leaflets. Please go through it so that you will know beforehand what exactly it is. And any doubts, you can come back to me anytime.
Okay, thank you, doctor. Thank you very much.
So let me summarize today. Today we are talking about Umar's condition, and he needs a procedure called lumbar puncture to rule out the brain infection and give him the best treatment possible. Dr. All are
Time is
time
over.
finish or still there?
Time is over.
Just one thing, Dr. Noor, I really think should we give this diagram like that means want it to be very complicated for the mother? I don't know. Probably it is the right choice, but
Just 1 minute, just
yeah. I think you're having a phone call.
the fibers.
yeah.
Okay. And the diagram, I saw some teacher. Okay, where is my diagram? Can I draw the diagram?
You want to draw? Okay, draw. Wait, I will erase mine. And wait, before that, Dr. Muzna, what you are telling about the diagram? Tell us, please.
No, sorry, my voice was mute. I was just thinking that should we draw those vertebrae and everything?
No, not the word. You will show that you will put the needle in between these two small bones. Okay. And
Technicalities.
it will be in a place there the nerve cord is already ended. You have to show this that the place where you are putting the needle, there is no more nerve cord. This is very important. And anyone for that matter, they are worried about damage to the nerves. Okay.
Okay.
So, and it's your choice if you want to tell about vertebrae or does not want to tell, it's okay. But actually, as we know that we are putting in between the vertebra. If anyone can give a better and easy drawing, no problem. Go ahead.
Also, some more, if the mother concerned about the headache, you can tell that we will using a small and very tiny needle, and this will reduce the risk of this headache. And if the needle is small, the risk of the headache will be more or less.
Okay, what about for the alternative procedure? I said that but I did not tell all these imagings and all, because it will really confuse and they will say that imaging is the best. But imaging will not give you what is the bug and what is the antibiotic. So just tell that there is no other alternative for this procedure which will guide us best. This is my answer. So anyone wants to comment on this?
Another scenario, Dr. Noor, like
You're right.
Same scenario, like the parents do not agree. Okay, suppose then you will feed the baby or not?
Yeah, we will treat the baby. Already the baby is in antibiotics, is on antibiotics.
Yeah, but the duration, so how long would you treat?
Yeah, how long
Duration,
you will treat?
Yes,
And what is the best antibiotic? What you are giving, is it right for the baby?
Yes. And also important for steroid. Like for bacterial, we use steroid, but for viral, we will not use steroid.
For what? For what?
Steroid, dexamethasone.
I can't hear you clearly. Can you
Yeah,
speak
steroid.
louder?
Why?
Okay, so my answer for the alternative is there is no best alternative other than this. It's better. Okay.
Yes, the other benefit of this procedure that we should know exactly what is the type of bug for the benefit of the surrounding. If we know the bug exactly, we can use prophylactic antibug for the surrounding.
Prophylactic antibug for the family members, you mean?
Yeah, for the family members. Yeah.
Means other siblings or?
Yeah.
Okay. So usually for lumbar puncture, they are using the local anesthetic xylocaine or no? Or just spraying, or what is the anesthetic they are doing?
Yeah, they are using this Epla cream.
Which one?
Epla. Amla. Amla or Epla? Amla. Okay.
Yeah.
What is it exactly? They are putting locally or just like the spray or needle or what?
Locally.
This is yeah, locally cream. This is actually Amla cream.
Cream. It is the cream applied locally. Cream.
So this can be asked by the so you can tell that local painkiller will be applied. Okay.
Yeah.
Before putting the needle, a local painkiller will be applied to minimize the pain. And always there is risk versus benefit. Here the benefit is more than the risk. These are the common we use for all. And we say
Dr. Noor, this is not a painkiller cream. This is not painkiller cream. Use this is numb the skin so that the child will not feel the pain.
Anesthetic, yeah. And
so
for
we cannot use the word
anesthetic is
anesthetic.
jargon. Anesthetic we cannot use. This is jargon.
We
We will
numb
apply
the
some cream
skin.
to numb the skin so that he will not feel the pain.
Yeah. Yes, you're right. Jargons.
Another point is in neonate. If it is a neonate, we don't do EMLA also. Neonate only breast milk.
Yeah, in the neonate no.
Neonate just directly you will do or what?
Yes, because the
neonate
directly
we are doing breast milk, some milk can be given.
Yeah, so some breast milk, the baby will sleep, then you will do. Because in neonate, we don't use this EMLA because neonatal skins are very thin. So there is a loss, hazards of using this cream. So in neonate, it is written that anesthetic we don't use. Even we don't use painkiller so much. Yeah, sucrose you can use for painkiller. Yeah.
So for me, these are the questions I had made. That is damage to the nerve. This is the worry of the mother, and alternative procedure because she's not interested to go for that. And one more question, why it was not done yesterday? It was rightly answered by Dr. Muzna that the child was unstable yesterday with high grade fever, fits, and decreased level of consciousness. These three things you can tell.
One thing in telling about the alternative procedure, they are saying that you should not hide anything from the parents. So I think we should tell that brain scan, but it will not help us.
Yeah,
we should not hide.
So my answer is there is no other best alternative procedure to tell us about the bug and what antibiotic is needed. Now this procedure we want to do to know the bug and how long we want to treat this patient and what is the best antibiotic. all these three answer we will not get with any scan, right?
Yeah, yeah.
So for
Yes,
this
yes.
purpose, there is no best alternative. This is what I am telling. Because if we tell the scan, like how I told her, I will say that no, I want to go with scan only, like this.
Yes, you have to close this door by saying that there is no alternative for this procedure.
Yeah, you can tell her that there is no alternative procedure which will give us the bug, the right antibiotic for the bug, and how long the treatment has to be given. All these three answers will not be answered by any other scan or anything. And I think it's clear, right?
Yes.
Okay. So we will go for the next scenario if no other comments, or anyone wants to tell us what other questions can be asked for this scenario other than this.
Dr. Noor, just one thing I want to ask you. It is a brain infection, or should we say it is the infection of the layers or this coverings of the brain?
Yeah, you can say, but maybe if you tell the coverings or they have to understand, right?
Mhm.
This is the thing. So I think if we say brain infection, it will cover all these things: meningitis, encephalitis, everything. And the fits, it can be from meningitis, it can be from encephalitis, or it can be some abscess also, but abscess is less likely because it's just a very short history.
But in actual scenario case is not there. It is not the infection of the brain involvement. No? It is the coverings that are affected. No?
Yeah, so I think, okay, we can tell, but I don't know how you will describe for the mother. Tell me without jargon.
It will be the layers around the brain. Infections
Okay,
of the layers
we
around
can
the
say
brain,
that we are
or
suspecting.
coverings around the brain.
Okay, we can say that we are suspecting an infection in the coverings around the brain.
Yes.
Okay.